Hello everyone. Today's class we are going to continue with the complication of Puerperium. In the last class we have studied about puerperal sepsis, that is infection during the Puerperium or postnatal period. In the today's class we are going to discuss about puerperal pyrexia. Okay, means fever during postnatal period. The first one is definition. An evaluation of temperature to 38 degree centigrade or 100.4 degree Fahrenheit or more occurring on two separate occasions at 24 hours apart, excluding the first 24 days following delivery, is called as puerperal sepsis or puerperal pyrexia. Causes. The first cause is puerperal sepsis. Obviously, if there is an infection, there is a fever. Yes, it can reduce the or it can increase the body temperature. Then urinary tract infection, cystitis, pyelonephritis, breast infection, infection of laparotomy wound and cesarean section, and intercurrent infection like acute bronchitis or pneumonia or influenza or acute appendicitis or enteric fever. These are some causes of getting puerperal pyrexia. Next one is nursing management. The first management one, isolation. Okay, if the patient is having fever, we have to keep the patient separate. Maintaining proper hand washing, patient placed in Fowler's position to facilitate the drainage, and educate the patient on hand washing and perineal care. And emotional support to the patient. Check the vital signs properly, maintain the fluid intake and output chart, and sufficient rest is enforced by the analgesics and sedatives. Okay, so this is about the puerperal pyrexia. Next we are going to study about the sub-involution of the uterus. Now first one is, what do you mean by involution? Involution means the process where the reproductive organ will come back to the normal stage after the delivery is called as involution. But if it is not occurs, okay, then we will call it as sub-involution. Okay. The first one is definition. The sub-involution of the uterus is impaired and deficient involution of the uterus following the delivery, when the uterus is not revert back to the pre-pregnant state both anatomically and physiologically. In that case, we will call it is a sub-involution of the uterus. Means it is not coming back to the pre-pregnant state both anatomically and physiologically. The causes, or you can say predisposing factor, like grand multiparity. Grand multiparity means if the woman have more than like 4 or 5 children. Okay, if they given 4 or 5 children delivery, so what happened, the elasticity of the uterus, it's already loose, so it will not come back to the normal state. Okay, this is the one cause. Over distension of the uterus as in twins and hydromenous, means in case of twins baby, two babies. Okay, what happened, the uterus will be over distended, so in that case also there is a chance of getting sub-involution. Then maternal ill health, cesarean section, prolapse of the uterus, uterine fibroids, and no sucking of the baby. Okay. Next one is clinical, like excessive or prolonged discharge of lochia. So what are the causes we have studied previously? These are the predisposing factors. Now I'll tell you the clinical like reasons, like excessive or prolonged discharge of lochia. Okay, irregular or excessive uterine bleeding, irregular cramps like pain, uterine height more than normal for the particular day of the postpartum. So like normally we know that fundus will reduce by 2.5 centimeter in 24 hours, but in this case it will not reduce like this, so we can come to know that the patient is having sub-involution of the uterus. Next one is management. So in the management, first one is sub-involution is managed by treating the causes. So first we have to treat the underlying causes. What is causing this problem? So that cause should be treated first. In that, first one is antibiotic for the sepsis, exploration of the uterus for retained products. Okay, like sometimes what happen, even after delivery also some products of the that delivery, it will be remain inside. Okay, that can cause infection. So what we have to do, exploration, we have to check that if there is any retained product inside. Then pessary in the prolapse or retroversion, early ambulation during postnatal period, daily evaluation of the fundal height to document the involution. So with this we have studied today about the puerperal pyrexia and sub-involution of the uterus. Thank you.